Hi, let's study H. pylori infection and its eradication in an integrated manner between pharmacology and microbiology. It's a very high yield topic and commonly asked in NEET PG, INI-CET and FMGE. So let's start directly with eradication of H. pylori. It is done by 3 drugs, which is remembered by this very famous mnemonic CLAP, CLAP. So first is Clarithromycin for C. Clarithromycin is a macrolide antibiotic. It inhibits by working 50AS ribosome. Then we have Amoxicillin, which is a beta-lactam antibiotic and it inhibits cell wall synthesis. Then we have the proton pump inhibitors, the PPIs, which we commonly say. Examples are omeprazole, pantoprazole, esomeprazole. The duration of this regime is 2 weeks or 14 days. And let me just tell you the concept in brief. Basically, the proton pump inhibitors, they increases the gastric pH. They inhibit the gastric acid, of course, and then they increase the gastric pH towards alkalinity, which improves the antibiotic stability and penetration. Hence, there is better eradication of H. pylori. Now coming to the microbiology aspect of H. pylori, it is a gram-negative curved or spiral bacillus. It is urease-positive, okay? It's a very important point about H. pylori. It's a urease-positive and it colonizes the gastric mucus layer. The virulence factors, again a previous year question, are CagA protein and VacA toxin. Now let's discuss the concept of how H. pylori survives in the gastric environment. So H. pylori basically has a urease enzyme. This urease enzyme converts urea into ammonia, and this ammonia basically forms a layer around H. pylori which acts as a protective barrier from the acid in the stomach basically, and that's how it survives. And as I explained earlier, proton pump inhibitors inhibit the gastric secretion, acid secretion. They make the overall environment alkaline, and that's how the antibiotic penetrate the H. pylori and the effect is seen. Also, H. pylori is associated with duodenal ulcer. So nearly 95% of the duodenal ulcers are associated with H. pylori. It is also associated with gastric ulcer, gastric adenocarcinoma and MALT lymphoma. And in case of penicillin allergy, we can replace amoxicillin with metronidazole. If clarithromycin resistance is suspected, we basically go for a Bismuth quadruple therapy, which has PPI, Bismuth, tetracycline and metronidazole. So this was basically a quick review of H. pylori infection and its treatment regimen. Comment down notes in the description and then we'll send you this nicely written handout with detailed explanation. Thanks for watching. See you again.